Hello there, and welcome to the very first episode of Talking Diabetes with Pitso Molemane. I am Pitso Molemane. I have lived 43 years with type 1 diabetes, essentially my whole life. I have designed this podcast to help people who are struggling with diabetes in the country and also to help those who are not living with diabetes so that this podcast is going to give you information. We are going to bring here experts, doctors on medicine, on diet, but also people who can help us with exercises so that we can live long. I'm so excited to welcome Dr. Patrick Piotie. Dr. Piotie is a diabetes specialist. He's the champion of diabetes. He is the global health expert. Global health expert. Did you hear that? Yes. Dr. Piotie is also the Diabetes Alliance chairperson in the country. Doc, so excited to have you here as our guest, our first guest for the first episode of Talking Diabetes with Pitso Molemane. Welcome, Doc.
Thank you. Thank you very much, Pitso. It's a pleasure to be here this morning. And obviously, I've been following your work. I appreciate your passion for diabetes awareness and to inform our public because, as you and I know, there is so much lack of information when it comes to diabetes in our communities. Therefore, I was really pleased to be the first guest of this podcast, and I hope it will be a great success.
Thank you so much, Doc. You mentioned something very important there. Too much lack of information with regard to diabetes. Let's start this talk in the simplest possible terms. This disease, diabetes, what is it?
Yes, that's a difficult question because, as you know, diabetes is one of the complex diseases that we have out there. But we're going to try, you and I, to make it very simple for the audience and for our people at home. Diabetes, in short, is what is called a metabolic disease. It's a condition that occurs when the body is not able to manage glucose or called sugar. When we eat food, the food is broken down into what is called glucose. It's just a type of sugar. It's normally the fuel for our body. So it's like if you have a car when you need to pump fuel to drive around. So for us to move around, we need that fuel, which is sugar. Now, when the body breaks it down and it's in the blood vessel, it had to be transported into the cells. It can be your muscles, it can be your brain, and so on and so forth, so that you can be able to use that energy as you go by the day. The problem with diabetes is that either that glucose that you have in your blood sugar, in your blood vessels, is not able to move to your cells because there is a challenge with the key. Let's say, for example, the key here is the insulin. That should allow the glucose to move from the blood to the cells. Now, if there is no key, obviously the door cannot be opened. Therefore, the sugar remains in the bloodstream. Secondly, there could be keys, but there's a malfunctions in terms of that the doors are not necessarily opening because it's called insulin resistance. Therefore, the end result is that the sugar remain in the blood at a high level, and it can lead to some damages.
Indeed. Thank you so much, Doc, for explaining that. I like it when you say that it's like, putting fuel in a car. So unfortunately, when there's that insulin or glucose, they are not working together, and then that's how we experience diabetes. Doc, what are the signs of if somebody, Doc, might have diabetes? What signs should they look for?
No, indeed, that is very important because we need to be aware of what's going on so that we can look for help very early. When that sugar is high in the blood, the body starts having certain reactions. And those are the ones that create those signs that we will be talking about now. For example, excessive thirst, whereby because the sugar is high, the body push the person to drink more water, thinking that that's what will balance the level of sugar. So it's just a reaction. As a result, the individual will be drinking too much water. Obviously, if you drink too much water, you will tend to urinate frequently. So those two symptoms are also connected. Excessive thirst, therefore drinking too much water, therefore going to the toilet, meaning a frequent urination. Now, there is also, because the sugar is in the blood, is not able to move into the cells, the body doesn't have the energy to operate, the body will start looking for other energy sources. And that can be looking for the fat in the body and burning that fat to use it as energy. As a result, there is unexplained weight loss. So this is somebody who suddenly start losing a lot of weight without being on diet, without necessarily exercising, or without necessarily doing anything to lose the weight. So that will lead to excessive weight loss. Another symptoms that we can observe is blurred vision. When there is high sugar in the blood, the vision can become blurry. Other symptoms can be wounds that are not healing quickly, or can be frequent infections. So those are symptoms that, when taken individually, it might just mean anything. For example, unexplained tiredness. When we are tired, we can say, oh, I had a long day at work, or you can connect it to the stress that you've been experiencing recently, maybe in the family. Meanwhile, it's diabetes that is behind. So we need to be self-aware, and when those symptoms are combining, it becomes the time where we need to go to the clinic.
Wow, Doc, thank you so much for that information. Doc, we hear of different types of diabetes. The most common ones being type 1 diabetes and type 2 diabetes. What is the fundamental difference between type 1 diabetes, type 2 diabetes? Who is at risk?
Indeed, that's a very important question. And indeed, we found that to be a critical information, because when you have either type 1 or type 2, the management differs in some ways. The management is not the same. So let's start with type 1. Type 1 diabetes, as we described the mechanism, in type 1 diabetes, the body is failing to produce the key, which is insulin. Because of self-destruction, the body is not producing that insulin. Therefore, those individuals need to be put on insulin from the time they are diagnosed. So when we identify them, they need to be put on insulin as a matter of urgency. Otherwise, there are other problems that can occur. Usually, it's younger age, all the way from months old to a couple of year olds. But in the African population, we also see younger adults who can be diagnosed with type 1 diabetes. Type 2 diabetes, on the other hand, it's a different type of condition that occurs usually more on an older age. There's many factors behind type 2 diabetes. But in the main, it's when the body might have still some insulin. So the factory is still producing some insulin, but the body is failing to use it optimally. So here you have a scenario where either the production of insulin is limited, or the body is struggling to manage with with using the insulin that is there. That is usually happening at the older age, and there are what you call risk factors that can be behind type 2 diabetes. For example, the issue of overweight or obesity can be a factor, the age can be a factor, the type of diet, unfortunately, the unhealthy lifestyle, as we describe it, not exercising enough and not eating properly. Those are some of the factors, but I'm sure we'll break it down in terms of what is actually behind the rise of type 2 diabetes, because as it is now, we are seeing it more even in our younger age, all the way to the children, which was not supposed to be.
Indeed. Doc, there's also hereditary, the family background. How is it connected to diabetes, and which type of diabetes is hereditary playing a role there?
Yes, it's complex because indeed, when we do some observation, there seems to be some genetic predisposition with diabetes. Because often you'll find when you see a family with a child of type 1 diabetes, we often see another siblings in that same family who also might have a type 1. I've seen a few brothers and sisters being diagnosed with type 1 diabetes and so on and so forth. On the other hand, we know also that there is a family predisposition when it comes to type 2 diabetes. But now, there hasn't been specifically like a specific gene that has been identified to say, oh, he has this gene, he's going to have diabetes. It's more, that's why I say it's a bit complex, because when you look at the family, and we are in the context of type 2 diabetes, a family tends to share the same environment and the same habit. We eating the same, we like the same thing most of the time, we watch TV, we sometimes when you see a family that is very more active, where they go on hikes and stuff like that, you can see you can see it on the family members. On the other hand, if there is not that intentionality in terms of moving, eating healthy, you can also see it. So because of sharing those environmental factors together, we can see easily that if a family member has type 2 diabetes, the likelihood or the chance of having another family member with type 2 diabetes is quite high. So that's where we say it's a bit complex. It's not necessarily a specific gene, but even the environment in which we are living can also play a role.
Indeed, Doc. That's very scary, Doc. Doc, but very important, Doc. What happens if, as a person living with diabetes, I'm failing to control it? The research is telling us, and then I know that you've done a lot of research on this, the complications of diabetes.
Indeed, that is really a good question. And what we need to emphasize here is that a person can live a healthy and long life with diabetes. That's why I appreciate when I see you not only as an advocate, but also who demonstrate that you can live for 40 years with diabetes and be active and be fulfilled and still contribute to society. So we need to reassure our people at home that diabetes is not a life sentence. That being said, it's important that we understand once you have diabetes, there are some things that need to be implemented in order to avoid the consequences of having high level of sugar in the blood. Because that high level of sugar in the blood will affect the eyes, it will affect the mouth, it will affect the kidneys, it will affect our ability to fight infections, our ability for our wounds to heal. For example, we might have a wound on the foot, but it's not healing for a long period of time compared to somebody who doesn't have diabetes. It can also affect our nerve, our capacity to feel. For example, a person with diabetes can step on a nail and have a whole nail in the foot, but not feel it because they don't feel the pain like another person will feel. So because of those consequences that are linked to having a high level of sugar in the blood, that sugar in the blood will eventually damage the pipes. The pipes are the blood vessels that are supposed to carry the sugar from one point to the other and bringing them to the cells. So eventually then it can damage the pipes and damage the organs that we describe, our target organ that are mentioned, from the brain to the eyes to the kidneys to so on and so forth. So that's when diabetes become problematic. So the challenge here is to keep the blood sugar level at an acceptable level through medication, but also through a change of lifestyle and exercising and eating well and moving around. Those are the actions the steps that we can take in order to maintain the blood sugar at an acceptable level.
Indeed, Doc. Is there a cure for diabetes?
Unfortunately, not yet. There is, as you described, type 1, type 2. There's also gestational diabetes that we should have say a few words about. about the pregnant woman. The pregnant woman, sometimes during that pregnancy, they experience a high level of sugar in the blood, and as soon as they deliver the baby, it goes back to normal. But they need to be monitored because they are at risk of having type 2 diabetes. It's important that we send this message home for the women who might be listening. If you are pregnant, you need to control your weight gain. You need to still move as much as you can, obviously with the advice of your health professionals. Then going back to your question in terms of the cure for diabetes, type 2 diabetes, we haven't found a cure yet, similar to type 1 diabetes, but there is a lot of progress in terms of research, specifically with type 1 diabetes. For our listeners, we say that in type 1 diabetes, the factory, meaning the production of insulin, is damaged. So what people are now doing is trying to fix the factory. They are using some cells that they can take from another person. Obviously, there is a lot of engineering behind it, but basically it's to explain shortly to the listeners, they are trying to fix the factory so that the person with type 1 diabetes doesn't have to inject themselves insulin anymore, but the body can start producing that insulin again. So that's what is happening with type 2 diabetes. Unfortunately, there is no cure yet, but there's a thing called remission. Some people might have heard about it or also seen it on the social media. With remission is when the person living with diabetes implement measures, lifestyle changes that lead to the blood level in the sugar going so low that they might not necessarily need to be on treatment anymore. Nonetheless, they need to be monitored, and that weight loss that they have experienced need to be maintained for the remission to last longer.
Indeed. Doc, in my journey, and then, engaging with a lot of people, most of the people are asking me this question to say that they are adopting a healthy diet. But even though they do exercise, Doc, take medication consistently, and then you'll find that the sugar spikes. What can be the challenge there? And this is one of the important questions that people are asking. And some of them, they want to lose hope, saying we do everything that we are doing, but what might be the challenge?
It's complex because, as we indicated, diabetes is quite a complex condition, and we describe it as a metabolic disease. There are many factors that plays. What food did we eat? What time of the day did we eat that food? What was in the food? We spoke about the food being broken down in sugar. There are what is called hidden sugars. Some of the things are obvious. Okay, there's sugar in cakes. There's sugar in biscuit, in chocolate. Those are the obvious ones. But there are other meals where sugar is hidden. So that can play a role. But now, as a person itself, there are physiological aspects to it. For example, we've seen discussing with people with diabetes, especially the women, they say when they have their periods, their sugar are all over the place, even though they will be doing the same thing that they were doing prior to the time of having their periods. So it's really complex to be able to pinpoint that those sugar spikes might be due to this aspect or that if we don't have a very close look at the situation. Therefore, our advice here is to say, first, we cannot lose hope. We need to keep doing what we are doing, but keep track. If, for example, you note, do I have flu? When it happens, you take note. Is it because I ate this or that? You take note. Is it because of a time of the day? You take note. So that when you have your meeting with your doctor, you can give them as much information as possible so that they are able to find exactly the reason why, despite you following a good diet, exercising, and taking your medication, you are still having those sugar spikes.
Yes, Doc. We cannot run away from this myth or misconception with regard to erectile dysfunction. Normally you see so many men, I'll give my example, Doc, approaching me, being an influence on diabetes, approaching me, seeking advice when coming to the difficulty in maintaining or getting an erection while they are living with diabetes. I call it a myth, doc, or a misconception, because it's not like when you are diagnosed with diabetes today or tomorrow or next week, then you automatically suffer erectile dysfunction. It's a process whereby you allow it, for lack of better word, because you're not taking care of yourself, you're not controlling that. But let's talk about that, doc. Why is it erectile dysfunction so related to diabetes, but also I have never suffered, doc. I've got 2 kids, I'm happy, and then I've never suffered at all. But for the fact that I've lived with diabetes since I was a child, and then I've learned a lot on it. But doc, I'm not the messiah here. I've gone through the complications of diabetes. I mean, at one stage, doc, I had a minor stroke. I had the challenge of the eyes, as you mentioned, that the complications, I was using glasses. And then after changing my life, that's how I've become healthy. So I've said to a lot of people that erectile dysfunction might be the results of failing to control sugar, whereby high glucose in the body has affected the nervous system.
Yes, your information is on point, and I appreciate you bringing up this topic, because indeed in our communities is one of the main concern, especially for our men in the communities. As you know, naturally already men are slow to seek help. So when now you put them in a position where they can be feeling vulnerable, as you know, you either you are in a couple, you are married, you have a partner, it's a very difficult discussion even to start with the partner. Therefore, we see a lot of men shying away or running from care when they hear of the word diabetes. But that obviously, as you know, is because of lack of information that we're trying to address now. So it's important for the men out there to indeed understand that diabetes doesn't equal erectile dysfunction. With either with a weak erection or an erection that cannot be maintained. It's not automatic, as you say, that if you have diabetes, you're going to have erectile dysfunction. We describe diabetes as a situation with high sugar in the blood that affect the pipes, which is the blood vessels, and the nerves. When we're talking erection, these are two of the most important things. You need the pipe because the body need to pump blood into your organs, your penis, for it to get hard. You need the nerve because that's what triggered the whole process. So as you said, if we don't take care of our diabetes, if the blood sugar is not kept in the normal levels, we are not exercising, we are not necessarily eating well, as a result, body will progressively, those nerves and those blood vessels will progressively be damaged and affected. As a result, there might be erectile dysfunction. Therefore, the advice here is to say, if you are a man, you've been diagnosed, or the doctor is saying, watch out, you might be heading towards diabetes, don't freak out, don't get scared. Instead, ask for more questions. Empower yourself with information and implement those measures that will help you to maintain your blood sugar at an acceptable level.
Indeed. Gentlemen, you've heard it for yourself, From the expert, Dr. Piotie, gentlemen, please prioritize your well-being. If you've got issues with diabetes, you don't know how to ask, you don't know where to go, Dr. Piotie is one of the experts when coming to diabetes. We will share the doctor's number at the end of the program. But Doc, coming back to you, Doc, can erectile dysfunction be treated?
There are ways that we can assist in the situation. I will confess I'm not a neurologist or a specific expert in that field, but because we say it's a consequence of not optimal management or a poor management of the blood glucose, the first thing one might do is to manage the glucose well, to manage the sugar levels well. Once that is back in track, hopefully they haven't been might be described as irreversible damages. So if the person is therefore controlling their sugar well, I'm sure the expert might have more other products that can assist in those people having better and stronger erections.
Indeed, indeed. What about women, Doc? Can an unmanaged diabetes also, affect a woman or the sexual activeness of women?
Indeed, indeed. Uncontrolled diabetes also have impact on women. For example, infections. It can lead to frequent infections in women. It can lead to a lack of appetite when it comes to having sexual intercourse. It can lead to even dryness in the vagina. So that can affect, because as we say, diabetes equal high sugar in the blood, and the blood is going everywhere in our body, and as is traversing out or traveling around our body with that high level of sugar, it will damage various organs differently. So therefore, in the woman, the vagina can be affected, and obviously the moods can be affected, and we already mentioned that they can have one can have frequent infections with diabetes. So even for women, it's important that they look after themselves having diabetes.
I've seen so many women, Doc, asking that, especially those who are in the early diagnosed stages, asking that, can they, I want to put it in another way, that, can they have healthy pregnancies and deliver healthy babies while living with diabetes?
Yes, indeed, you are right that it's one of the main concern for our women out for the women out there, and yeah, the answer is yes. I think we need to be reassuring here and to be factual. The answer is yes. A person living with diabetes, whether it's type 1 or type 2, or even gestational diabetes, meaning she has just been diagnosed as she is carrying that baby, can deliver a healthy baby. First of all, I've seen also women who are scared that they might pass it on to the child. We need to first say that no, if you are living with diabetes, whether it's type 1 or type 2, it's not automatic that your baby will also have diabetes. That's one. Secondly, when you are living with diabetes, if you are planning to be pregnant, you need to talk to your doctor. They need to check, are your blood sugar okay? Are you on a stable situation? Once those are checked, you can then get the go ahead to become pregnant. Once you are pregnant, you need to continue maintaining those blood sugar at the normal level, because what you are trying to avoid here, if you have high blood sugar in the body while you are pregnant, remember the mother and the baby also, their blood communicate. Therefore, your baby will also have high blood sugar. That will lead to them being bigger than what they should be, and obviously they can be having there can be complications when you deliver the when the lady deliver the child. So it's important. It's all about sugar control. When you are pregnant, if you are planning to be pregnant, make sure that you are accompanied by, you are supported by your doctor, your health professionals. You control your blood sugar to an acceptable level, and when you are pregnant, you keep it the same. You try to eat healthy as much as you can. You exercise, you move around, and therefore you can have a healthy delivery and a strong baby.
Indeed. Doc, one of the goals of Talking Diabetes with Pitso Molemane is to give the truth and the facts. Right now in South Africa, Doc, we're seeing diabetes having surpassed other diseases like HIV, cancer, heart disease, with regard when coming to natural death.
Mm-hmm.
Diabetes now, Doc, is the leading cause of death, natural cause of death
Mm-hmm.
among South Africans.
Mm-hmm.
And it is a national crisis.
Mm-hmm. Mm-hmm. Yes, Pitso, I agree with you. And that's why I like the fact that we are having the conversation today. Diabetes, according to Statistics South Africa, which is a respectable and leading institution in the country in terms of statistics, diabetes is the number one cause of death. And that has been there for already a couple of years now in the whole. So, indeed, we have reached crisis level because this didn't happen overnight. When you look at Stat SA reports, the number of deaths due to diabetes have doubled over the past 10 years. So it's a progression that has led to us being where we are today. And you and I, who are spending a lot of time not only engaging with various people, but also reflecting and thinking about the situation in which we are, we understand, looking at our health system, looking at the type of care people living with diabetes are receiving, and the help that they are not necessarily getting, not only from the health system, but also from society. We realize that it is time to sound the alarm. That's why we call it a crisis. As advocates, we say this is a time to say it cannot be business as usual. We have reached a stage where diabetes is the number one cause of death. Many people are not only losing their lives, but as you know, Pitso, and as we discussed, there are the complications in terms of amputations, in terms of cardiovascular complications, losing of sight, blindness, and all those complications. All that impacting in a country where we are struggling with our economy. Because a young man or a productive person affected by diabetes might lose that productivity, lose that ability to contribute to society. Therefore, there is a loss of income, not only from themselves, from their family, but also for society, South Africa as a whole. Therefore, because of that, those intricate factors, because of the fact that we can see that we've been not, we haven't been on top of this condition, we say it is time to sound the alarm and to call it for what it is. I agree with you fully. Diabetes is a crisis. That's why the Diabetes Alliance, with about 25 organization partners, have decided that we should call it what it is. Diabetes in South Africa is a national crisis, and it requires a specific intervention, not only from the government, but also for everybody involved, including societies and families.
Indeed, Doc. Let me unpack what Doc has just said. Death mortality or death statistics from Stats South Africa is telling us that diabetes kills nearly 27,000 people in the country, South Africa. Diabetes only. This loosely translated, diabetes kills close to 78 people every day. Every day we are losing 78 people because of diabetes. That is why the Diabetes Alliance and Dr. Piotie are approaching or have approached the president to say, Mr. President, please, let's have education on diabetes. Let's see how the Department of Health and government can help or save lives as we are losing 78 people per day with regard to diabetes. Doc, somebody who might have been diagnosed with diabetes, what will be the best advice that you can give so that the person does not become the statistics of the 78 people who are losing on a daily basis?
That's a very critical question, Pitso. And we need to be frank here. If you have been diagnosed with diabetes, with the experience that we have and what we've seen out there, our first advice is get information. You need to take charge Yes, I don't really like that approach because it's like I'm putting the burden on the individual, but you need to be honest that what will make a big difference between the person A and the person B is the one who first don't deny, accept his or her condition, and empower himself or herself. When you get as much information as you can, accurate information, correct information, you are able to play a bigger role in your own care. Because as you know, Pitso, how often do we go to the clinic, even living with diabetes? Maybe once every month, maybe once every 3 months. And those visits are maybe 15 minutes. If you are lucky in the public sector, 20 minutes maybe. So you spend 20 minutes with the health professionals, but you spend the rest of your life with yourself and your family. So the first step is look at it as a car. You are the driver of this car. You cannot rely on your passenger to tell you what is a stop sign, what is the red light, what is the green light, what is the speed on the street. You are the driver of this journey of yourself living with diabetes. So empower yourself as much as you can. Then the next call is the family. A supportive environment, a supportive family that is not stigmatizing the person, where it's not judgmental, where they feel really in a safe space, also help. So the family should also assist and get knowledge and information. But then I'm sure your next question, and we'll get back to it, will be what is actually do we want to see from a supportive health system, and also from a supportive government, and from a supportive country, so that the person living with diabetes is not left fighting a battle against the whole world.
Indeed, Doc. This brings to an end of our discussion today, the conclusion of the first episode. And we indeed, Doc, extend our gratitude to you as an expert discussing this, giving us information, helping us also, Doc, to live long with diabetes, to eat healthy, but to take care of our lives, to prioritize the well-being, especially men. We appreciate it, Doc, and we thank you for that.
No, thank you. Thank you very much, Pete. So as I said, this is really a great opportunity, and I will be keeping an eye on your podcast, hoping that it really gets traction out there. We know our debates in houses are high nice about the Matlanga Commission and those challenges, but it's also important that we talk about health and we talk about diabetes. And as a parting shot, I really want to close by saying that the Johannesburg Declaration for Accelerated Action on Diabetes in South Africa, it's really calling for a coordinated action response led by the presidency. As you said, we've reached out to the president of the country, we've reached out to Parliament, we've reached out to the Department of Health, we've reached out to the Treasury, and we are still waiting to hear back, because 78 people are dying every day. These are too many lives. So we are calling on our leaders in the country to really take diabetes for what it is. It's a national crisis, but you and I and many others are ready to work hand in hand with government to make a difference in the country. So thank you very much.
Thank you so much, Doc. It's indeed a pleasure. Continue doing the good job there at the Diabetes Alliance.
Thank you.
Thank you so much. Yes. Goodbye for now, and please remember to prioritize your health.
Want to feature your business here? Partner with our podcast to reach a passionate, health-conscious audience. Contact Fighting Diabetes to discuss advertising opportunities. info@fightingdiabetes.co.zai 08209 56290.